How your doctor having AI might save your life. Imagine walking into your doctor's office with a nagging cough that won't go away. Your doctor listens, asks a few questions, and runs some tests. But here's what's different. Behind the scenes, an artificial intelligence system is analyzing your symptoms against millions of medical cases, catching a rare condition that might have been missed. This isn't science fiction. This is happening right now, and it's about to change healthcare as we know it. The integration of artificial intelligence into healthcare isn't just another tech trend. It's a fundamental shift that could mean the difference between life and death, between a missed diagnosis and early detection, between bankruptcy from medical bills and affordable care. But like any major transformation, it comes with profound implications for everyone involved, from the patients in hospital beds to the investors watching from Wall Street. And today, we're diving deep into the AI healthcare revolution. We'll explore how these technologies actually work, what they mean for your health and your wallet, and how they'll reshape the medical landscape for workers, families, and the economy. Whether you're a blue-collar worker worried about affording healthcare, a medical professional concerned about your future, or someone who just wants to understand where medicine is heading, this affects you. So let's break it down. Let's start with where we are right now, because AI in healthcare is already more advanced than most people realize. At this very moment, AI systems are reading mammograms with accuracy that matches or exceeds human radiologists. They're predicting which patients in intensive care units are at risk of deteriorating in the next few hours. They're discovering new drug compounds that could treat diseases we've struggled with for decades. And they're doing it all faster, cheaper, and in many cases, more accurately than traditional methods. Take the example of a company called PathAI. They've developed an AI system that helps pathologists diagnose diseases by analyzing tissue samples. In studies, their system has shown the ability to detect cancer in biopsies more accurately than pathologists working alone. But here's the key. It works best when the AI and the human pathologist work together. The combination is better than either one alone. Or consider how Google's DeepMind developed an AI that can predict acute kidney injury up to 48 hours before it happens. For context, acute kidney injury is a common and serious complication in hospitals that affects around 20% of hospitalized patients. Early detection can literally mean the difference between recovery and permanent kidney damage or death. This AI doesn't replace doctors. It gives them a superpower, the ability to see into the near future and intervene before disaster strikes. Then there's the diagnostic revolution happening in dermatology. AI systems can now analyze skin lesions from smartphone photos and flag potential melanomas with remarkable accuracy. This means someone in a rural area, hundreds of miles from a specialist, can get an initial screening without leaving home. The AI doesn't make the final call, but it helps determine who needs to see a doctor urgently and who can wait. These aren't experimental prototypes. These are working systems being deployed in hospitals and clinics around the world right now. The AI healthcare revolution isn't coming, it's here. Now let's talk about the most powerful impact AI is having in medicine, catching diseases earlier when they're still treatable. Human doctors are incredible, but they're limited by time, memory, and the sheer volume of medical knowledge that doubles every few years. A single doctor can't possibly remember every rare disease presentation, every drug interaction, and every subtle pattern in test results that might indicate a problem. But AI can. Consider sepsis, a life-threatening condition where the body's response to infection damages its own tissues. Sepsis kills around 11 million people globally each year, and the key to survival is catching it early. Every hour of delayed treatment increases mortality risk by 8%. AI systems are now being deployed that continuously monitor patient vital signs, lab results, and medical history to predict sepsis before the obvious symptoms appear. Hospitals using these systems are reporting up to 20% reductions in sepsis mortality. Or think about heart disease, still the #1 killer worldwide. AI algorithms can now analyze electrocardiograms, those squiggly line heart tests, and detect patterns that indicate future heart problems years before a human cardiologist would spot them. One study showed an AI could predict which patients would develop atrial fibrillation, a dangerous irregular heartbeat, within the next year with 80% accuracy, just from a normal-looking ECG that a human would read as completely fine. The implications are staggering. We're moving from reactive medicine, where we treat diseases after they cause symptoms, to predictive medicine, where we identify and intervene before you even feel sick. This doesn't just save lives, it prevents suffering, reduces the need for aggressive treatments, and dramatically cuts healthcare costs. For rare diseases, which affect around 400 million people worldwide, AI is proving especially valuable. Most rare diseases take years to diagnose because doctors simply don't encounter them often enough to recognize the patterns. AI systems trained on comprehensive medical databases can suggest rare disease possibilities that might not occur to even experienced physicians, leading to faster diagnosis and treatment. So we've established that AI in healthcare is powerful and it's already working. But what does this actually mean for regular people, for working-class families trying to make ends meet and keep their loved ones healthy? Let's be direct. Healthcare costs are crushing American families. Medical bills are the #1 cause of bankruptcy in the United States. The average American family pays over $12,000 a year for health insurance alone, not counting deductibles, co-pays, and out-of-pocket expenses. And despite spending more on healthcare than any other nation, American health outcomes often lag behind other developed countries. AI offers a potential path to bend this cost curve downward. Here's how. First, AI-assisted diagnosis reduces errors and missed diagnoses. Medical errors are estimated to be the third leading cause of death in America, causing over 250,000 deaths annually. Many of these errors stem from diagnostic mistakes, delayed diagnoses, or failure to act on test results. When AI acts as a safety net, catching what humans miss, fewer people get harmed, which means fewer costly malpractice cases, fewer emergency interventions, and fewer wrongful death scenarios. These savings ripple through the entire system. Second, AI enables preventive care at scale. Right now, preventive care often falls by the wayside because doctors are overwhelmed with patients who are already sick. AI systems can monitor populations, identifying people at high risk for diabetes, heart disease, or other chronic conditions, allowing for early intervention when treatment is cheap and effective. Preventing a disease is always cheaper than treating it once it's advanced. Third, AI democratizes access to expertise. If you live in a rural area or an underserved urban neighborhood, you might not have easy access to specialists. AI brings specialist-level analysis to any clinic with an internet connection. A nurse practitioner at a rural health clinic can use AI tools to provide diagnostic accuracy that previously required a trip to a major medical center 2 hours away. For blue-collar workers who often have physically demanding jobs with higher injury rates and health risks, AI-powered monitoring could mean earlier detection of work-related health issues. Imagine wearable devices that monitor for early signs of repetitive strain injuries, toxic exposure effects, or cardiovascular problems, alerting workers and their doctors before minor issues become disabling conditions that end careers. But let's also acknowledge the concerns. As AI handles more routine medical tasks, will healthcare jobs disappear? Will insurance companies use AI to deny coverage more efficiently? Will the benefits of AI healthcare flow mainly to wealthy patients who can afford the latest technology, while working-class patients get left behind? These are legitimate questions we need to address as this technology rolls out. Now let's turn to the people who work in healthcare. From nurses to doctors to medical technicians, roughly 18 million Americans work in healthcare. How will AI reshape their professional lives? The anxiety is real and understandable. When you hear that AI can read X-rays or diagnose diseases, if you're a radiologist or a diagnostician, you might worry about your job security. But the reality emerging from early AI deployment is more nuanced than robots replacing doctors. For physicians, particularly specialists like radiologists and pathologists, AI is becoming a powerful assistant rather than a replacement. Radiologists using AI tools report that they can read scans faster and with more confidence. The AI handles the initial scan, flagging areas of concern, and the human expert makes the final judgment. This augmentation means each radiologist can handle more cases without burning out, and they can focus their attention where it matters most. General practitioners and primary care doctors might see the biggest positive impact. These doctors are often overwhelmed, spending more time on paperwork and administrative tasks than actually treating patients. AI scribes can document patient visits in real time. AI assistants can suggest relevant questions to ask based on symptoms. AI can handle prescription renewals and routine follow-ups, freeing doctors to focus on complex cases and actually talking to their patients. Many doctors went into medicine to help people, not to fill out forms. AI gives them that opportunity back. For nurses, especially those in critical care settings, AI monitoring systems act like an extra set of eyes that never blinks. Instead of replacing nurses, these systems alert them to patients who need immediate attention, helping them prioritize in chaotic environments where every second counts. This could reduce the crushing stress that leads to nurse burnout and leaves the profession short-handed. Medical technicians, from lab workers to imaging technicians, will see their roles evolve. Rather than being replaced, they'll increasingly operate sophisticated AI systems, requiring new training, but potentially leading to higher-skilled, better-paid positions. However, some healthcare jobs will inevitably change or disappear. Medical transcriptionists, already declining due to voice recognition technology, will continue to see reduced demand. Some administrative and coding positions may be automated. The healthcare industry will need robust retraining programs to help workers transition into new roles. The key insight is this: AI is best at narrow, repetitive, pattern recognition tasks. Humans remain superior at empathy, complex reasoning, handling unusual situations, and providing the emotional support that sick and scared patients desperately need. The future of healthcare isn't doctor or AI. It's doctor and AI working together. Let's shift perspective and look at this through an economic lens. For investors, pharmaceutical companies, insurance providers, and the broader healthcare economy, AI represents both massive opportunity and significant disruption. The healthcare AI market is projected to reach hundreds of billions of dollars in the next decade. Major tech companies like Google, Microsoft, Amazon, and Apple are pouring resources into healthcare AI. Traditional healthcare giants like Johnson & Johnson, Pfizer, and United Healthcare are either developing AI capabilities or partnering with tech firms. Startups are sprouting everywhere, from companies developing AI diagnostic tools to those building virtual health assistants. For pharmaceutical investors, AI is revolutionizing drug discovery. Traditionally, bringing a new drug to market takes over 10 years and costs billions of dollars, with most candidates failing in clinical trials. AI is dramatically accelerating the discovery phase, identifying promising drug compounds and predicting their effects with unprecedented speed and accuracy. Companies like Recursion Pharmaceuticals and In Silico Medicine are using AI to discover new drugs in months instead of years. This could mean more drugs reaching patients faster and at lower development costs, fundamentally changing the economics of the pharmaceutical industry. For hospital systems and healthcare providers, AI represents a necessary investment to remain competitive. Hospitals that effectively deploy AI will provide better outcomes at lower costs, attracting more patients and payer contracts. Those that lag behind risk becoming obsolete. We're likely to see consolidation, with larger healthcare systems that can afford AI implementation, absorbing smaller hospitals and clinics that can't. Insurance companies are already using AI for everything from processing claims to predicting patient risk and detecting fraud. This could lead to more accurate pricing and faster service, but it also raises ethical questions about algorithmic bias and discrimination. Regulators will need to ensure that AI-powered insurance decisions don't unfairly disadvantage vulnerable populations. For medical device companies, AI integration is becoming a key product differentiator. The next generation of imaging machines, monitoring equipment, and diagnostic tools will have AI built in, and companies that lead this integration will capture market share from those that don't. Venture capital is flooding into healthcare AI startups. In recent years, healthcare AI companies have collectively raised tens of billions in investment. For investors, the opportunities are enormous, but so are the risks. Many AI healthcare startups will fail as the technology matures and the market consolidates. The winners, however, could become the Googles and Amazons of healthcare, generating massive returns. The broader economic implication is that healthcare, which already represents nearly 20% of the US economy, is undergoing a technological transformation comparable to what happened in retail with e-commerce or in transportation with ride-sharing. Fortunes will be made and lost, workers will need to adapt, and the system that emerges will look fundamentally different from what we have today. Before we get too carried away with optimism, we need to confront the serious challenges and concerns that come with AI in healthcare. First, there's the issue of algorithmic bias. AI systems learn from data, and if that data reflects existing biases in healthcare, the AI will perpetuate or even amplify those biases. Studies have shown that some medical AI systems perform less accurately on women and people of color because they were primarily trained on data from white male patients. If we're not careful, AI could actually worsen healthcare disparities instead of solving them. Second, privacy concerns are enormous. AI systems need vast amounts of patient data to learn and improve. Who owns this data? How is it protected? What happens when there's a breach? Healthcare data is incredibly sensitive, containing not just your medical history, but potentially genetic information that could affect your children and grandchildren. We need robust privacy protections and clear consent mechanisms. Third, there's the black box problem. Many advanced AI systems, particularly deep learning neural networks, work in ways that even their creators don't fully understand. They can reach accurate conclusions without being able to explain their reasoning. In medicine, where understanding the why behind a diagnosis is crucial for treatment decisions and patient trust, this opacity is problematic. Regulators and researchers are working on explainable AI that can show its work, but this remains an ongoing challenge. Fourth, liability questions are murky. If an AI system suggests a treatment that harms a patient, who's responsible? The doctor who followed the suggestion? The company that made the AI? The hospital that deployed it? Our legal and regulatory frameworks haven't caught up with this technology, creating uncertainty that could slow adoption or leave patients without recourse when things go wrong. Fifth, there's the digital divide. If AI-powered healthcare requires smartphones, reliable internet, and digital literacy, people in poor communities, elderly populations, and rural areas without broadband could be left behind. We risk creating a two-tiered healthcare system where the wealthy get cutting-edge AI-assisted care, while the poor are stuck with increasingly outdated traditional approaches. Finally, there's the cybersecurity threat. As healthcare becomes more digital and AI-dependent, it becomes more vulnerable to cyber attacks. Ransomware attacks on hospitals have already disrupted care and endangered patients. AI systems themselves could be targeted, with hackers potentially poisoning the data they learn from or manipulating their outputs. These aren't theoretical concerns, they're active threats requiring constant vigilance. So where do we go from here? How do we maximize the life-saving potential of AI in healthcare while minimizing the risks and ensuring the benefits reach everyone? First, we need thoughtful regulation that keeps pace with technology. The FDA has begun approving AI-based medical devices and software, but the regulatory framework needs to evolve to handle AI systems that continuously learn and update themselves. We need standards for testing AI medical systems, requirements for transparency about how they work, and clear accountability when they fail. Second, we need to prioritize equity in AI healthcare deployment. This means intentionally developing and testing AI systems on diverse patient populations. It means ensuring that rural and underserved communities have access to AI-enhanced care, not just wealthy urban centers. It means training healthcare workers from all backgrounds to use these tools effectively, and it means watching carefully to ensure AI doesn't become another factor that widens health disparities. Third, we need to invest in workforce development. Healthcare workers need training not just in using AI tools, but in understanding their capabilities and limitations. Medical schools should integrate AI literacy into their curricula. Continuing education programs should help practicing clinicians adapt to AI-assisted practice. And we need robust programs to help healthcare workers whose jobs are disrupted by automation transition into new roles. Fourth, we need patients to be educated and engaged. People need to understand when AI is being used in their care, what it can and can't do, and what their rights are regarding their data. Patient advocacy groups should have a seat at the table as these technologies are developed and deployed. Fifth, we need business models that align incentives properly. If AI makes healthcare more efficient, but doctors and hospitals are paid per procedure, there's a misalignment. We need payment models that reward better outcomes and preventive care, creating financial incentives for healthcare providers to embrace AI tools that genuinely improve health rather than just increase billing. Sixth, we need ongoing research into AI safety and effectiveness in healthcare. Just because an AI performs well in a lab doesn't mean it will work in the messy reality of clinical practice. We need long-term studies tracking outcomes when AI is deployed, and we need to remain humble about what we don't know. The road ahead requires collaboration between technologists, clinicians, patients, policymakers, and ethicists. No single group has all the answers, and the stakes are too high to get this wrong. So, will your doctor having AI save your life? The honest answer is, it might, and the odds are getting better every day. We're standing at the beginning of a fundamental transformation in healthcare. AI isn't a magic bullet that will solve every problem, but it's a powerful tool that, used wisely, could make medicine more accurate, more accessible, and more affordable for everyone. The question isn't whether AI will transform healthcare. It already is. The question is whether we'll guide that transformation thoughtfully enough to ensure the benefits reach all of us, not just the privileged few. If this video helped you understand what's coming in healthcare and what it means for your life, hit subscribe. We cover the technologies reshaping the world in plain language every single week. Share this one with someone who needs to hear it, because this story belongs to all of us.